So, coming to the last section of the lecture today, which is the treatment. So, we need to see what are the different treatment options that we can provide to our patient with irritable bowel syndrome. As you all know, irritable bowel syndrome tends to be a lifelong disorder. So, it's a disease that is going to stay with the patient for a very long time. And establishment of a strong relationship between the patient and between the physician is a key role in treating the patient. So, a good relationship usually causes the decreased use of medical services. Usually, patients they come up to the outpatient department and to the doctor with irritable bowel syndrome after a very long period of having these symptoms. So it's very necessary to ask the patient that what is the reason that he has come up to you at this moment, and what are the things that he's curious about. It could be because of a lot of reasons. It could be because of some new life stresses that are causing him having this irritable bowel syndrome. It could be because he just wants to know why is he having these symptoms. Is it a very serious illness, or is it just a illness that could be treated? So there are a lot of questions that a patient with irritable bowel syndrome will be wondering about. So it's very necessary to have a good relationship with the patient and having to know that what are his queries, and so that you can treat him accordingly. So, if we talk about the suggested sequence of treatment of irritable bowel syndrome, so as the patients have a lot of symptoms that they present with, so we'll be talking about the treatment of these symptoms accordingly. So, if the patient has bloating, what are the treatment options? We could ask the patient to adjust his diet and treat the constipation that causes the bloating. This could include probiotics, it could be non absorbable antibiotics such as rifampicin, it could be tricyclic antidepressants, and it could be SSRIs, which are the selective serotonin reuptake inhibitors. So, these are the different treatment options that we can offer to these patients. So now we could treat constipation. Constipation could be treated with the help of fiber supplements, which is also known as ispergola, polyethylene glycol, and then we could also treat the patient with drugs such as lubiprostone, linaclotide. And then diarrhea. Diarrhea is one of the major symptoms of irritable bowel syndrome. It's very necessary to treat the patient. We could treat the patient with loperamide, which is 2 milligram plus 2 milligram, 4 milligram. And then treating the patient with 5-HT3 antagonist, which is also known as alozerton. And then treating the patient of symptoms such as abdominal pain is also very necessary. We could treat abdominal pain with the help of antispasmodic drugs and then peppermint oil. And then treating the patient psychologically with the help of tricyclic antidepressants, selective serotonin reuptake inhibitors, and then having some sort of psychological therapies. So, these are the symptoms that are very necessary to be treated with patients with irritable bowel syndrome. And then there are some non pharmacological treatment options that we can offer to patients with irritable bowel syndrome. These include hypnotherapy. Hypnotherapy, it improves the cognition. And then we could also offer the patient cognitive behavioral therapy. It has an excellent efficacy data that CBT has helped patients with irritable bowel syndrome. And then providing the patients with soluble fiber, like I've mentioned before, ispergola could be used on a routinely basis that helps improve the constipation, the bloating, the diarrhea. And then providing the patient with low FODMAP diet, which is the fermentable oligodimonosaccharides polyols. So this diet could help the patient. And then exercise is also seen. There are some tests done, some research is done that exercise could improve the irritable bowel syndrome. And lastly, probiotics have also had a significant role in treating the patients with irritable bowel syndrome. And then, if we talk about the pharmacological treatment specifically to the subtypes, such as the irritable bowel syndrome with constipation, with diarrhea, and the mixed type. So, we'll be talking about their treatment options. So, patients with irritable bowel syndrome with constipation, they could be treated with chloride channel activators such as lubiprostone, and then we could treat the patients with guanylate cyclase agonists. There have been a lot of researches done that it is very viable, and it has proven that these treat the patients with constipation. It does cause diarrhea in around 5% of cases, and the drugs that include in this is the linaclotide. And then selective serotonin reuptake inhibitors such as alosertin has also shown that constipation can also be treated with the help of this psychological therapy. So, if we talk about the pharmacological treatment for the subtype of patients with irritable bowel syndrome with diarrhea, so the treatment option is the rifaximin, which is the non-absorbable antibiotics. 5-HT3 receptor agonists have also shown that they do provide relief from the diarrhea, alosertin. And then patients with treated with tricyclic antidepressants, antispasmodics. Some of the side effects of antispasmodics have been dry mouth and dizziness. And other than that, peppermint oil has also shown good improvement in patients with diarrhea. Other than that, if we talk about tricyclic antidepressants, it's usually recommended that they start off with 10 to 25 milligram of desperamine, and then gradually increasing it within the week and within the month. Some of the side effects of tricyclic antidepressants includes drowsiness and dry mouth. So now if we talk about an overview of the treatment options, so constipation with irritable bowel syndrome, and then diarrhea specifically with irritable bowel syndrome, and then the bowel syndrome that is predominantly having the abdominal pain. So if it's sort of a mild, it's in the mild category, we could educate the patient, we could reassure the patient, and we could provide them with stress management. So these are the options that are given to patients who come up with mild sort of symptoms. And then if the patient presents with constipation and it's more of a moderate type, we could provide the patients with fiber, exercise, fluid intake, like we've mentioned before. Osmotic laxatives have also shown improvement, and antispasmodic agents, and then serotonin 4 antagonists. So ultimately, these are all the steps that we could take, and then the last criteria would be the psychotherapy and the tricyclic antidepressants, and then sedation with antispasmodic agents. So, if we talk about the more severe type of patient presenting with constipation, serotonin 4 agonist has shown a vital role. Now, if we talk about patients with diarrhea, having a trial diet that excludes lactose and caffeine and other dietary changes such as wheat, because it could be that the patient is wheat intolerant or lactose intolerant. So we could provide the patient with this sort of a diet, and then treating the patient with loperamide and antispasmodic agents. Loperamide, like I mentioned, the patient could have from 2 milligram to 16 milligram of loperamide per day. And then if this doesn't work, we could provide the patient with the same psychotherapy, tricyclic antidepressants. And then ultimately, in severe cases, we could ask the patient to have serotonin 3 antagonists. And if we talk about the pain management, if the patient has some sort of moderate pain, we could offer the patients antispasmodic agents and then tricyclic antidepressants. And then lastly, serotonin 3 antagonist if diarrhea is associated with this sort of a pain. So this brings us to the end of our lecture regarding irritable bowel syndrome. We've talked about irritable bowel syndrome in detail. We've talked about the risk factors, the causes. We've seen the clinical features of irritable bowel syndrome, predominantly having constipation, diarrhea, or the pain. And then we've talked about the pathophysiology, that what could be the reasons why a patient might be having this sort of a syndrome. And then we've seen that the diagnosis of the irritable bowel syndrome is usually done on the basis of history and physical examination. Lab tests don't really provide us the diagnosis, but the careful history is the main element in diagnosing. And then we've seen the different treatment options, that are the pharmacological treatment options and the non-pharmacological treatment options for the patients with irritable bowel syndrome. We've seen that there are constipated related drugs, and then there are drugs for diarrhea, and then there are drugs for severe pain. So I hope you've enjoyed our lecture today, and to watch more lectures, please subscribe sqadia.com. Thank you for watching.